so that, say like you have your whole percentage of HIV, so you put in like an integrase inhibitor, maybe like 1% of the HIV is a little bit different that inhibitor can't bind. And so you kill 99% of the virus, but then that 1% is there, and it proliferates so fast that you really didn't hurt the infection at all. What this means is that protease inhibitors, depending on what you're targeting, they can be infected pretty quickly. Proteases after a few days. The reverse transcriptase inhibitor, zidovudine, I think, which is AZT, ineffective after only a few months. So this makes it only useful for short-term treatments. Like if a HIV-positive mother is pregnant, they'll give her that so she has low enough HIV counts just in time for the baby to be born, and kind of lowers the chance for passing along the virus to the child. How do we get around this? Combination therapy, also known as highly active antiretroviral therapy. So even if, so say you use integrase, even if some of the HIV is immune to that, then you put in the entry inhibitor and protease inhibitor, so you kind of cover all your bases and you kill all HIV. However, as you can see, it stops HIV from replicating. It doesn't stop already infected memory CD4 T cells or macrophages and dendritic cells from being stopped. You can tell that the virus is not eradicated. When patients stop taking the medication, the infection rises pretty quickly after they stop taking it. Once you have HIV, in the graphs that Emily showed, the long kind of flat part, that's clinical latency. And that's when you have new CD4 T cells being made constantly when you have an infection. But HIV virus is produced and cleared from the cells faster, so that there's an overall decrease in CD4 T cells. And to illustrate that, say you have 5 CD4 T cells, the virus kills 3 of them, you only make 2 more. The virus kills 3 more, you still only make 2. Kills 3 more, you still only make 2. So, so it takes a while for its effects to be seen. Go back to the same graph, you can see initial infection, your body fights back, doesn't eradicate the virus cells, so eventually they come back. Same thing, there's the CD4 T cells, initial infection, they go down because the immune system is activated, they get back up, but eventually they decrease. And this is an important line right there, that's the onset of AIDS. We'll go into the next one. Eventually your CD4 T cell count is so low, you can't fight off infections that normal healthy people would be able to fight. So that's called seroconversion. That switch below that little line of CD4 T cells, and that's when you start getting succumbing to infections that people would normally be able to, like oral respiratory infections like pneumonia Emily was talking about, or latent herpes viruses that kind of sting you like the cold sore kind of.
So I'm going to talk about some case studies with potential advancements in hopefully eradicating HIV. 30% of all HIV-positive mothers will pass the antibodies to the children, but only a fraction of those mothers actually, or fraction of those babies born with those antibodies actually contract the virus. About 330,000 babies born each year are HIV positive. And so I have a video of, so there's 2 newborns, quote unquote cured, don't have to use that word, I'll explain later, of HIV, and this is an introduction to the first case.
So a baby of HIV for the first time in history. Anthony here for D News, and this is potentially a huge achievement in medical science. A report released yesterday by Johns Hopkins University details how a 2-year-old child in Mississippi was cured of HIV that it had at birth. So the deal is this: the child's mother had not received any medical care while she was pregnant. She also didn't know that she had HIV. So that means she didn't receive the drugs that a mother's normally given during pregnancy to reduce the risk of transferring HIV to her baby. And since the delivery team didn't have any time to take the usual precautions in this case, they immediately transferred the baby to the University of Mississippi Medical Center in case the virus had transferred. Now, normally an infant that young is only given preventative medications to keep symptoms in check. But because the baby was at an unusually high risk, the doctors at the center decided to take an unusual course of action, and they put the baby on 3 aggressive antiretroviral drugs only 30 hours after its birth. Now, that isn't ever done, and that's an important thing to remember here. They kept the baby on the drugs and kept testing for HIV. And after 29 days, there were no detectable signs of the virus. Gone. They kept the baby on treatments, but the mother began missing appointments when it was 18 months old. And they finally got to test the baby again at 23 months, and they expected to see an uptick in the virus. But there wasn't one. The child still tested negative. So this is awesome, right? The virus was functionally cured in this kid. But there are still some variables here. First off, a lot of children with HIV-positive parents also test positive for HIV, and it's usually just because of antibodies transferred over from the mother. Doesn't always mean the baby actually has the virus. Doctors are pretty sure that this child was actually infected, but that's just something worth noting. The second thing to know is that this might not be a cure in the strictest sense, okay? By putting the baby on such intense medication so early, some doctors are saying the baby wasn't infected in the truest sense of the word. The virus didn't get a chance to hold and build up what's called a reservoir. And that's why experts say that this breakthrough isn't relevant to adults with HIV. But that still means that getting aggressive early on can stop the virus from taking hold in a baby. Continued testing of the child is going to be required too, just to make sure that this is really gone for good. So it's not a general cure. One doctor called it a hypothesis-generating case. Usually babies aren't put on retrovirals for 6 weeks after they're born, because doctors want to know that they're really infected and it's not just those antibodies. This shows that there might be a reason to start them on aggressive medication immediately, no matter what. All in all, 330,000 babies were born with HIV or acquired it during breastfeeding in 2011. So anything to reliably and safely cut down on that number is a huge win. More details about the case are going to be released this week, so check out the links below if you want to keep up with the story, and subscribe.
So that's a little intro into the first case that was introduced. There was also a second newborn cleared of HIV. It was a baby in Long Beach, California, and it was a baby girl. She was born to a mother who had advanced age, mentally ill, and she was not actually keeping her HIV her AIDS under control.
Did you say advanced AIDS or
Advanced AIDS and mentally ill. So she wasn't taking her medication to control the virus. So she was actually given what we talked about previously, the preventative care for the baby, but she was not taking them because she was mentally ill. So after the baby was born, 4 hours after birth, they drew blood to test for HIV. The baby was positive. They started the baby, once again, on extremely high doses of this, the antiviral medication, which is high risk, so the doctor had to weigh the high risk of giving this medication against like the toxicity of the meds. And just in case this baby was actually born with HIV, like they said, usually they wait 6 weeks to do it, just to make sure they know the baby is infected, and it's not just the antibodies. But this particular doctor saw the case in Mississippi, so she kind of went from there. The baby is now in foster care, so the baby is healthy in foster care, and the mother is still alive and well, still on drugs, so they actually can't say that this baby is cured, because it's unethical to actually take the baby off drugs, but potentially in the future they do want to take the baby off, or the kid off these drugs to see what happens. I think about 2 years of age they wanted to start doing that. Both the DNA and RNA of the virus were found in the baby's early blood and spinal fluid samples. But 11 days after birth, the virus began to disappear and was undetectable. So, pretty exciting news.
what happen? What are the side effects of these? The risks associated with these drugs? Do you know?
But I don't know the exact risk, but when it comes to babies, because they have such already developing immune system, to introduce such a high level of medication can be toxic to this.
Have their
So I
kidneys
don't
shut
know the
down and
exact-
things like that. Yeah.
I don't know the exact side effects. There is going to be a clinical trial done on about 60 babies, and the doctor helping with this particular case is actually going to be helping along with it to essentially put this protocol into use for future babies, since the earlier slide said over 300,000 babies are born with HIV every year. So this would be an awesome new protocol to hopefully get a first step on that. HIV positive mothers who were given a treatment, less than 2% actually pass the virus on, so it's very important to get that first initial treatment in.